Now, the proportion that the NHI could possibly be funded through the PIC was recently tabled by government, with criticism coming from some quarters that this shows that the government still has no idea how the scheme will be funded. Senior analyst at the Institute of Race Relations, Marius Roodt, joins us for more. Marius, a very good evening to you. Thank you for your time. What does this latest announcement that the NHI could be funded through the use of funds from the Public Investment Corporation indicate about government's plans on funding the scheme?
Well, I think it shows that the government doesn't know where money for NHI is going to come from. The PIC shouldn't be funding things such as the NHI. The point of the PIC is to invest money for pensions of government employees and so on. And it's not supposed to fund these kinds of infrastructure, health and educational infrastructure and so on. That needs to come from money elsewhere within the government. One of the PIC's mandates is that it's got to get a return for its investors. And investing in hospitals and in certain places and so on, you're not going to get the return that the PIC needs to get. That said, the government obviously doesn't need to get a return for everywhere it invests, but that money must come from its ordinary taxes that it raises and so on. But we believe that there's simply not enough money for NHI at the moment, and we think there are other ways to expand healthcare in South Africa. Nobody is saying that all South Africans aren't entitled to get a decent level of healthcare. We just don't think NHI is the way to get there.
So while there's been a lot of criticism about the alleged lack of funding details in the NHI bill, it also seems that no one has actually questioned the funding requirements for its implementation. What we know is that the NHI bill provides the framework, the enabling legislation to change how all the money spent on healthcare in the country flows. But there's still a lot of grey area, isn't there?
That's exactly the question that everybody's asking. And just today, Health Minister Aaron Motsoaledi said that people that disputes in the GNU aren't going to hold up NHI, which I think is a bit concerning. As I say, nobody is opposed to South Africans getting decent healthcare. The problem is the NHI and how it's going to be funded. And the NHI itself is simply not the way to do it. Getting rid of private medical aids and basically getting rid of the private medical sector is not the way to ensure that all South Africans are able to access decent healthcare. What needs to happen is that more South Africans need to be able to access private healthcare through various ways. We can make it easier for South Africans to get on medical aids, to allow low-cost medical aids, for example. We can introduce things such as health vouchers, where people can decide where they want to spend money on, whether it's in the private or the public healthcare system. And what we actually need to do is grow the economy so we can get more people working who then can afford to pay for private medical aid if that's what they want. And if we have more people working and an economy that's growing, there's also more tax money for the government to spend on healthcare facilities for people and to expand our healthcare in South Africa.
So you're saying that government must just forget about the NHI and focus on what you're proposing, health vouchers. How would those work?
So what happened with the health voucher is that what people would be able to, so the healthcare budget would basically split up and each South African would be able to use that, they'd be given a certain amount, whatever it would be, say 10,000 Rand a year that they can spend wherever they want on for healthcare. They can then use it at a private healthcare a clinic or a public healthcare clinic, and they can decide what they want to do with it. But also what we think should happen, we should also make it easier for people to join medical aids. And another option is perhaps making everybody who's employed formally be a member of medical aid. For people on lower incomes, then their employers could subsidize that, and that could also then the employers could also get a tax break. But yeah, there's lots of ways to fix South African healthcare. We also need to look at just improving public healthcare facilities. We know that those are not working well at the moment, and that's where we need to also focus. We've all heard these horror stories that happen in government hospitals in South Africa, and a lot of it's not because of resources, it's just poor management, and that's what we need to start looking at, and that's what we need to focus on. And with all these kinds of things, the people who suffer the most from poor levels of government healthcare are poorer South Africans.
Yeah. As you talk about poor management, South Africa at the moment has close to 700 medical doctors who haven't been able to find work in the public sector since they qualified. We know, the shrinking health budget, rising salaries, medical negligence claims going higher and higher have meant the department can't afford to employ these professionals. This is, of course, the kind of situation which exacerbates the strain on the public healthcare system. You make reference to the health vouchers, an allocation of 10,000 Rand. Where would that come from?
Although 10,000 Rand, I'm not sure what the exact number would be, but it would be taking the actual existing health budget and then splitting it between South Africans, and then they can use it whichever they want. And you'd only be able to use it at a healthcare facility. It wouldn't be money that just goes into your pocket. And then we'd also see more competition between various healthcare facilities. And, it's not given that private healthcare facilities will be getting people's business. We do still get some very good government healthcare facilities in South Africa, and we'd see a lot more competition, I think, than between various healthcare facilities. And the better ones would be get more people come there and be able to access more resources.
What would the worst case scenario be for the NHI to drag even longer?
Well, the worst case scenario is actually that it gets implemented, and we see that basically it would put such a strain overall on the healthcare sector in South Africa. We'd see, I think, an exodus of doctors. For a lot of people, I think, who are able to immigrate, they probably look to immigration and so on. And I think we'd see the end of private healthcare in South Africa, which would put an even greater strain on the public health system. So I just think it's a system that hasn't been thought through properly. And I just want to emphasize that nobody is saying that we don't think that all South Africans aren't entitled to a certain decent level of healthcare. We just think NHI is not the way that South Africa will be able to achieve that.
Yeah, okay, very well. Thanks so much for weighing in on this discussion. Senior analyst at the Institute of Race Relations, Marius Roodt, joining us there to expand and give us their view on the proposition that the NHI could possibly be funded through the PIC.